On this first day of the new year, we start with more of what we saw in 2020, the coronavirus pandemic surging across the country. The U.S. now topping 20 million cases just 4 days after surpassing the 19 million mark. So if you didn't catch that, I'm going to repeat it again because the numbers here are staggering. 4 days, another 1 million Americans infected. And as we start the new year, there are nearly 347,000 Americans no longer with us because of this virus. And another case of that more contagious strain from the United Kingdom is here in the U.S., this time in Florida. So far, this new mutated variant popping up in at least 3 states, although experts say it doesn't appear to be more deadly. We do have some hope, though, in the form of vaccines. But the problem is the rollout is slow. Less than 3 million Americans have gotten their first shots of either Pfizer or Moderna's COVID-19 vaccine so far. Nowhere close to Operation Warp Speed's goal of distributing 20 million doses by yesterday. And if we don't pick up the pace, vaccines could go bad before they even get off the freezer shelves. NBC News correspondent Ron Allen joins me now. Ron, New York City was once considered the epicenter of this pandemic. Now it's looking to speed up the vaccination process. So where are they now? What's the plan, and how many vaccinations are happening in the city on a daily basis?
Well, in New York, the numbers are better, but they're still, like in the rest of the country and other parts of the country, there's only a small percentage of the vaccine that's been distributed by the federal government that has actually been administered by the city. There's still these bottlenecks in the system. Here in New York City, the mayor has announced this bold New Year's Eve plan, this resolution, I should say, this New Year's resolution, to administer 1 million dosages during the month of January. That sounds incredible. He, of course, is saying that they need a lot of help from the state and federal government's money to get this done. But it speaks to the dire need to get vaccinations done in a place like New York, where there has been such hardship. Will it happen? It's unclear. But across the country, there is a push to get this vaccine process moving much more smoothly. There are a lot of bottlenecks. There are places where there are staff shortages. There are places where the vaccine just isn't getting out of the door as quickly as a lot of public health experts and a lot of others want it to. So that's where we are right now. Simone?
As you mentioned, there are states around the country that are really struggling with the volume of vaccines. Let's talk about Arizona, for example, where we're learning that 4 out of 5 doses that arrived in the state this week had not been used. What are some additional reasons behind why this is happening there? You mentioned staff shortages, Ron.
Well, the problem is budgets. State and local health departments have had their budgets cut over the years, and this year they have, of course, undergone all kinds of challenges trying to deal with the pandemic that's been plaguing the country. And now the latest chapter, trying to get vaccines distributed. Before it was testing, and those lean budgets, that lack of resources, is what so many states are saying is the problem with getting the vaccines out. They want more help from the federal government. We've heard that so many times before. The federal government's pointing the finger back. At least the Trump administration is. It'll be interesting to see, and the hope is that the Biden administration incoming will take a more aggressive approach to trying to help cities, states, local authorities, local health authorities get this vaccine distribution process moving much more quickly than it has been. Simone?
And this is some troubling news that probably the Biden or Trump administration could not have seen coming, out of Wisconsin, where a hospital worker is accused of intentionally ruining hundreds of vaccine doses. Can you tell us any more about what happened there?
Well, it's a criminal matter, as you might imagine. This individual, his identity is not clear. His motives are not known. Apparently, he allegedly left out some of the vaccine that needed to be refrigerated, and it's spoiled. Unclear why anyone would do such a horrific thing at a time like this. It appears, however, the good news, if there is any in all of this, is that there are some 57 people or more who were injected with these vaccines, and the manufacturers and others are saying that no harm should come to them. The vaccine will not be effective, and they have to be redosed, but it shouldn't be harmful to them. That's the good news if there is any of this. But what this individual's motives were, Why he did it, allegedly, it's really unclear, but it's an example of the kinds of things that have been happening around the country, the snags, the long lines, the rocky road that this rollout has really been going down. The numbers are nowhere near the 20 million that the Trump administration predicted and set as a goal for the end of the year to have people vaccinated. We're down in the near 3 million. And a lot of the vaccine is sitting on shelves because it's not possible, it's not efficient, it's not able for local health authorities to get this out to people who need it and want it. So again, as we begin the new year, a lot of challenges ahead. Simone?
Yeah, it's to put it lightly, it's disappointing to hear that we are having trouble actually rolling out the vaccines. I mean, it doesn't matter that we had an extremely fast timeline in producing them if they don't actually get into people's arms. So let's pivot now and talk about new CDC predictions that are not good, estimating the U.S. could reach well over 400,000 deaths by the end of this month. Another issue that this country is facing is capacity in hospitals in states all over the country. Can you tell us more about where we stand right now as a nation and what we could potentially be looking at in the months ahead?
Well, you've spelled out the predictions, the forecast. The numbers are ever increasing, it seems. In places like California, the hospital situation is in Los Angeles County. In particular, the hospital situation is particularly dire. There's just overcrowding there, and a lot of other places around the country. There's also this new strain that has been detected of the virus that was first detected in the UK, and it's now in at least 3 U.S. states: Florida, California, and Colorado. And while the strain is not more deadly, it doesn't make people sicker, it does apparently spread more readily. So that, many think, is going to contribute to the numbers going up. The good news on that front, however, is that the vaccines do seem to be effective against that new strain as the strains that we've been more familiar with. So there's that. But again, we go back to the same problem of the vaccinations not happening as quickly as need be and as quickly as so many people want this to happen to fight back this virus. So again, now as we enter the post-holiday phase where so many millions of people have defied the public health warnings and pleas not to travel and visit with and spend time with loved ones in small family groupings, the fear is that the numbers are going to increase and that there could be a couple of very dark months ahead, bleak months ahead, before we get to the point where millions of people are vaccinated against the coronavirus. And hopefully by the spring, summer, which is the predictions now, when there will be widespread vaccinations, that we'll be able to beat this thing back and save lives, save more lives. Simone?
New year, same problems. Thank you so much for this comprehensive look at the COVID-19 pandemic across the country, Ron. All right, the numbers coming out of California are just staggering. Los Angeles County reporting its deadliest day from the pandemic just yesterday. We are so many months into this thing. 290 people dead, the previous record set just a day earlier. NBC News correspondent Steve Patterson is in LA with more on the desperate situation.
Simone, California has now broken through 25,000 deaths. It has really become the epicenter of this outbreak across the country. The estimate is, on average, that one person dies every 3.5 minutes in the state of California. The average is more something like one person dying every 10 minutes here in Los Angeles County, which is sort of the epicenter of the epicenter. The LA County now, the hospitals are so overwhelmed that they are diverting, most hospitals now diverting patients away in some form or fashion, which means that if they are too full or if they cannot handle the ailments that a person or a patient may have being brought into the hospital, that they simply have to close their doors to that person. When patients do arrive in ambulances, sometimes those ambulances are stacked about 10 deep, making patients wait up to 7 or 8 hours to get treatment because, again, there just simply isn't any room. ICU capacity at 0% across Southern California. And then when those patients do get into the hospital, because of those capacity limits, they're often being treated in places like a chapel or a gift shop or a conference room or an ER hallway or even the ambulance itself, because again, there just isn't any room. Hospitals scrambling to retrofit some of these hospital wings with ICUs is sort of a makeshift ICU in order to do the work that they need to. But the biggest problem really is the staffing. It is the ratios of the patients that are coming in to the trained ICU and specialized nurses that are typically used to one-on-one care, doing as much as they possibly can to save one life, patient by patient by patient, and instead are, because they're so overwhelmed by patients, have to see 2 or 3 or 4 or upwards of those numbers, which really puts the patient care in a dangerous situation, and it puts the nurses themselves in danger, because they're so spread out and dealing with so much and so exhausted and overwhelmed by this oncoming surge of COVID patients. Meanwhile, there is that other variant, the new variant that has been discovered that is thought to be more contagious. It was first discovered in Colorado, and then now new cases in Southern California, the first of which was on the 29th. A 30-year-old man came down with it, and now 3 others have been discovered as of yesterday in their 30s, 40s, and 50s. So far, of the people that have been interviewed, nobody has a recent travel history, which is now leading health officials to believe that this is much more widespread than originally thought. It is important to keep in mind that this new strain, while it possibly may be more contagious, that does not mean it is more impactful. It does not mean it is more deadly, but it is still one more thing that health officials, that frontline healthcare workers have to worry about on top of a pile of worries as this surge continues here. Simone?
Thanks, Steve. Well, from Los Angeles County to the UK, health officials there are defending their new plan to delay second doses of the Pfizer coronavirus vaccine. They want to prioritize getting the first dose out there quickly and into as many arms as possible, even if it means delaying second doses for people who already got their first shot. Now, they may now have to wait up to 12 weeks for the second dose. NBC News foreign correspondent Sarah Harmon joins me now to talk about all this. Sarah, I love the way that you have been breaking all this down, so I'm so excited that you're here. Tell us more about this plan and what type of reaction you're hearing from people there. I can imagine people in the healthcare sector and the pharmaceutical industry are not pleased with this idea.
Hey, Simone, good to see you. Yeah, you're exactly right. I mean, this is a controversial idea. And let's be clear, this is a deviation from the vaccination schedule that Pfizer recommends. They recommend, as we've said so many times, 2 doses 21 days apart. And that's what their phase 3 trials actually looked at. What the UK government is doing is saying you'll get the first dose when you get it, and then you'll get the second dose within 12 weeks. Now, Simone, remember they started giving Pfizer vaccinations here in the UK on December 8th. And that means that some people have actually already gotten the second dose, and many thousands more are due for it in the coming days and weeks. They're now being told you're not going to get it. You're going to have to wait. That's causing concern for 2 reasons. Firstly, when they consented to the vaccine, they consented to receive it on the schedule that Pfizer developed. The UK Doctors Association, which represents a lot of frontline workers with the National Health Service, wrote to the health secretary and said, they have real and grave concerns, I'm using their words here, about the sudden changes to the Pfizer vaccine regimen. It undermines the consent process, they say, and it completely fails to follow the science. So, Simone, that's a taste of what people are saying about this. To give you the other side, the UK government says that their priority here is to get as many people that first jab and hopefully some protection, as opposed to giving a smaller number of people the full scope of the Pfizer protection. So that's their decision. And as a public health authority in this country, they are entitled to make that decision, but they are facing pretty intense criticism right now. Simone?
Sarah, you mentioned that Pfizer is pushing back against the delay, saying that there's no science to back up the longer interval between the doses. Is there anything, though, that Pfizer can really do, or those doctors that aren't fans of this idea? I mean, is there anything that they can really do besides writing a letter?
Well, Here in the UK, doctors are the ones giving the vaccines in many cases in their local offices. Britain has a national health service. The vaccine was rolled out to vaccination sites, but it's also being distributed to some doctors' offices. And in fact, we are hearing from some doctors that they are going to go ahead and give the second dose to some of their patients. Simone, think about the logistics that are involved here. When you imagine the group that's been vaccinated here in the UK, it's primarily people who are over 80 and frontline healthcare workers, as well as some residents and staff in nursing homes. It's not super easy for a lot of those folks to get themselves to the doctor's office and home. They've already made these appointments, and they're being told that from Monday, they will in fact have to cancel those appointments and instead wait. Pfizer has sort of obliquely criticized this decision, saying they can't guarantee safety or efficacy, but ultimately they have acknowledged the decision is with the public health authorities. Simone.
Challenges with vaccine distribution in the UK, in the US. It does not look like it is an easy process, no matter where you live. Sarah, thank you so much. The super contagious new strain of COVID-19 detected in Florida, making it the third state to confirm a case of that variant, originally discovered in the UK. Now, this strain is known to be more transmissible, but not more deadly, according to health officials. And experts believe the vaccines can still be effective in combating this new mutation of the virus. So that is some good news. Joining me now, former Obama White House Health Policy Director and NBC News medical contributor, Dr. Kavita Patel. Dr. Patel, Happy New Year. Thank you so much for being here. The Florida State Health Department says this strain, thank you, was detected in a 20-year-old male with no history of travel. I feel like this is a good time for us to revisit and redefine that term community spread. So would you do that for us and tell us why that term is so relevant in discussing this case?
Yeah, absolutely, Simone. Great to be with you. And here's hoping to a much better 2021. But talking about this more concerning variant that's under investigation in the UK and kind of under observation here. To your point, more specifically, we do believe this is community spread because it's now in the community and not necessarily linked, Simone, to people who have been traveling from the area that it has come from, namely the UK, South Africa, and other countries. So before, when we could trace, for example, early in the pandemic, Simone, people who had traveled to parts of China or to places where we knew there were outbreaks, that was a very logical form of direct transmission. And then only several weeks later did we realize that there were people who had no contact with anybody who traveled, had never traveled themselves. And that's when we really started to see what we define as community transmission. The virus is just kind of everywhere, so to speak. And that's exactly what we're suspected of seeing in not just California, Florida, and Colorado from your excellent conversation with the governor, but it really means that it's probably in many parts of the country. We only sample under 1% of the actual tests in the United States for coronavirus under genetic sequencing. We only put a very small fraction. So it's hard to know exactly what the level of spread is, but Simone, it's safe to assume it's here.
And healthcare experts like yourself were already predicting a dark and deadly January. But the thing about this pandemic is that it's been a series of learning new information and adapting to that new information. So now that we're seeing more cases of this new COVID variant, how should local health officials adapt and shift their guidelines?
It's a great question. And you know, Simone, it's been kind of hard. I think you nailed it, though. Just when we think we understand this virus and this disease, something throws us for a bit of a loop, and you're seeing that play out. What local health officials really need to do is to do exactly what you saw Colorado, Florida, and California do, where they do try to prioritize setting aside some of those samples for genetic sequencing. It matters for a lot of reasons, Simone, including the fact that we do believe that the vaccines currently available in the United States and abroad work against this variant. But we need to make sure by testing the samples that are coming, and Simone, even more importantly, is to test people like myself who have been immunized and see if we can develop antibodies against those new variants. So that's number one. Number two, I can't stress this enough. Local health officials need to do as much of the education that they've been doing, but on top of that, education about the vaccine and vaccination process. You've highlighted it. It's going slowly. We need it to go faster, but that comes with also some education. People are also still reluctant to get this vaccine because they haven't been educated and they need to ask questions. So unfortunately, Simone, our local public health officials are truly trying to do 10 things at the same time, and they need support doing it from health professionals. And the media plays a great role. You've been doing a great job bringing attention to these issues.
Thank you so much. It's all about teamwork, right? All right. Well, I do want to ask you about the strategy that the UK is taking with its vaccines, delaying second doses of the PFIZER vaccine so more people can get a first dose as quickly as possible. Now, this is a really controversial idea. Doctors over there are criticizing the move, and here's what Dr. Anthony Fauci said about it.
You have to remember that when you're doing things like administering vaccinations, you want to do it based on the science. Yes, there is the advantage that if you do that, you can stretch out the number of doses you have. But we do not know really with any certainty, based on the trials that were done, what the durability of a single dose would be. And if you give a single dose, there really is not a guarantee that you're going to get the second dose available to somebody at exactly the same time that they need it.
Dr. Patel, what's your take on this idea? I mean, is this something that you think we should implement here in the States?
Yeah, I don't, Simone. Let me tell you why. Number one, we already know that we've got a problem, not with necessarily getting the doses to federal, local, state officials. It's a problem getting them in people's arms. We've already talked about the bottleneck. Number two, I completely agree, as usual, with Dr. Fauci. The evidence doesn't support it. Let me offer, though, Sarah did some excellent kind of breakdown earlier. The thing that is an incredible stark difference, Simone, between the UK is their National Health Service system. They are on a unified electronic record. They have a uniform insurance mechanism. It's very easy. It's much easier for them to tell who has received a shot, Simone, how old they are, where they live. And we can track that at a national level in the UK. We cannot do that in the United States. And I will just say that it would be one thing, Simone, if we had heard from the country that shelves are empty, freezers are empty, and that the vaccines have all been given out and we're just waiting for more. What we know is that shelves are still full and we have not gotten the shots into people's arms. And that tells me the bottleneck is human. It's not the supply of the vaccine, which is a bit of a contrast to the UK. So we must follow the science. We've been saying that for a year, Simone. We have to continue with what we know is the right thing to do, not just for Americans, but for the globe. And I'm going to say something that I don't want to start fear, but if we only partially immunize people and they don't get that second dose, there's all sorts of downstream complications potentially. Like you could see what we call immune escape, where viruses have a much more fertile environment to mutate and then potentially not have the vaccine work against them, which we know we don't want. So Dr. Fauci's right. I support the doctors in the UK, and I hope what we can do is get through these bottleneck issues and get vaccines into people's arms. Vaccinations save lives, vaccines don't. So that's the bottom line.
Well, I hope for the same thing. Thank you so much, Dr. Patel.
Thank you.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.